Hi, everyone, and welcome to today's webinar, Infection Prevention and Control, Guidance and Considerations for School Sealant Programs During the COVID-19 Pandemic. My name is Ashley McDermott, and I am the Director of Education of OSAP, and I will be your moderator. This webinar is supported by a contract funded by the CDC Division of Oral Health. The contents of the webinar are solely the responsibility of the speakers and do not necessarily represent the official views of the CDC or the U.S. Department of Health and Human Services. Before we get started, I'd like to go over a few housekeeping items. You will be in listen-only mode throughout the webinar. You can test your audio by clicking Audio Settings in the bottom left-hand corner. If you need closed captions, click on the link provided in the chat. You can submit questions by typing them into the Q&A feature. You can check Send Anonymously if you do not want your name attached to your question. Our speakers will address content-related questions at the end of the webinar. The chat feature has been disabled for participants, but we will be sharing resource links in the chat throughout the webinar, so be sure to look out for those. This webinar is being recorded, and the recording will live on the OSAP website. Now for a little bit about OSAP. OSAP is a nonprofit membership organization, and our mission is to be the leading provider of infection prevention and control education, training, and credentialing that supports safe dental visits. Our vision is that every dental visit is a safe visit. OSAP is an ADA CERP recognized provider and designates this activity for 1 CE credit. Instructions to claim will be provided at the end of the webinar. I would now like to introduce our two esteemed speakers. Kathy Eklund is the Director of Occupational Health and Safety and the Forsyth Research Subject and Patient Safety Advocate at the Forsyth Institute. She is adjunct faculty at Regis College Dental Hygiene Program, where she teaches a senior level course called Evidence-Based Decision Making. She was the 2017 to 2019 chair of the OSAP Board of Directors and a consultant on the ADA Council on Dental Practice. She serves as faculty for the New England AIDS Education and Training Centers and HIVdent.org. Over the past 35 years, Kathy has published papers and contributed to several texts on infection control and safety. She is an author of the 2003 CDC Guidelines for Infection Control in Dental Healthcare Settings and has lectured nationally and internationally on these topics. Dr. Jill Moore is the oral health consultant for Michigan Department of Health and Human Services, where she manages the SEAL Michigan program. In addition to her role in setting guidelines for school-based providers, she also assists in observing the infection control of licensed mobile dental providers in Michigan to help ensure that safety in mobile dentistry is always put first. Dr. Moore has also earned the OSAP Dale Foundation Dental Infection Prevention and Control Certificate. Everyone, please join me in welcoming Kathy and Jill.
Thank you very much, Ashley. This is Kathy, and I welcome all of you to the webinar today, and I hope you find it interesting. We're going to do some things in terms of the overview of the objectives, describing the interim infection prevention and control guidance for school sealant programs, and identifying strategies and resources for implementation and evaluation. Also going to discuss the impact on the roles and responsibilities of the school sealant program coordinator. Since March of 2020, many school sealant programs have been suspended as communities responded to the coronavirus 2019 pandemic. As programs begin to restart, guidance for infection prevention and control in school settings is vital to both providers, school administrators, and parents and guardians of students that are served. On December 1st of 2020, the Centers for Disease Control and Prevention, Division of Oral Health, published considerations for school sealant programs during the coronavirus disease 2019 pandemic. The OSAP Infection Prevention and Control Guide for school sealant programs during COVID-19 actually supplements the CDC guidance with additional considerations for practical implementation. The primary objective is to protect the health, safety, and well-being of students, teachers, staff, and dental healthcare personnel who participate in school sealant programs. School sealant programs are an effective way to reach millions of children with dental sealants to prevent dental decay. The Community Preventive Services Task Force strongly recommends using school-based sealant delivery programs to prevent decay among children. In addition, school sealant programs can be cost-saving within 2 years of placing sealants and delivering sealants to children at high risk for dental decay, and can be cost-saving also to Medicaid. CDC is looking at the fact that it is imperative that infection control standards are prioritized to ensure each student benefiting from these programs experiences a safe dental visit, and also to ensure that the dental health care providers' safety and health are also prioritized. The CDC considerations for school sealant programs during the coronavirus disease 2019 pandemic is intended to aid oral health programs that conduct school sealant programs, as well as the dental health care personnel who provide direct oral health care services, and also for school administrators as they prepare to implement these school sealant programs during the COVID-19 pandemic, while protecting the health, safety, and well-being of students, teachers, staff, and dental health care personnel. Regardless of the setting, dental healthcare facilities and programs should continue to apply the updated guidance for dental settings, as well as the guidance from the CDC framework for healthcare systems providing non-COVID-19 clinical care during the COVID-19 pandemic, as they make determinations for providing dental care. Dental settings should balance the need to provide necessary services while minimizing risk to patients and dental healthcare personnel. You can find the most up-to-date information about infection prevention and control practices on the CDC's COVID-19 page. School sealant programs are a very effective way to provide preventive oral health services to children who are at higher risk of developing dental decay and less likely to receive that dental care. So due to the coronavirus pandemic, many school sealant programs, as I said earlier, have been suspended for a variety of reasons, including school closures, state mandates, and schools that do open not allowing dental services to occur on site, and also due in part to personal protective equipment shortages. However, as school sealant programs restart, there are safety precautions that need to be addressed to protect the students, teachers, staff, and dental health care providers. The information in this document will be helpful for oral health care programs that conduct school sealant programs, as well as dental health care personnel who provide direct oral health care services, and also for administrators. Now in the CDC guidance, the dental guidance, administrative and work practice controls include avoiding aerosol generating procedures whenever possible. Use of ultrasonic scalers, air polishing, and other aerosol generating procedures are not recommended. If an aerosol generating procedure is necessary for dental care, use four-handed dentistry, high volume evacuation, dental dams, in particular full mouth dental dams. Personal protective equipment is implemented after administrative, engineering, and work practice controls, which, as you all know, we in dental healthcare really do rely heavily on personal protective equipment. Another aspect is to limit the number of dental healthcare personnel present during procedures to only those that are essential for patient care as well as procedure support. This guide on the OSAP website was funded by the Centers for Disease Control and Prevention Division of Oral Health. As said earlier, the contents of this document and of this webinar are solely the responsibility of the authors and do not necessarily represent the official views of CDC or the U.S. Department of Health and Human Services. The OSAP guide can be downloaded from the OSAP website, and at the time you download, you're going to be asked for your first name, last name, email address, and professional role. This personal information is to be able to measure the dissemination of the document. This guide supplements the CDC guidance consideration for school sealant programs during the coronavirus disease pandemic for school-based sealant programs and provides additional considerations. The guide has 8 topic sections with links to key supportive documents, and the remainder of this presentation will describe the guide and provide an overview of each of the sections. The first section is scope of services. Now, in December, CDC's updated guidance for dental setting included a definition of aerosol generating procedures, or AGPs, in which they say that aerosol generating procedures are procedures that may generate aerosols, and that is basically particles of respirable size, which is usually below 10 microns or micrometers. Now, aerosols can remain airborne for extended periods and can be inhaled. CDC says that development of a comprehensive list of aerosol generating procedures for dental healthcare settings has not been possible due to limitations in available data on which procedures may actually generate potentially infectious materials and the challenges in determining their potential for infectivity. There is neither expert consensus nor sufficient supporting data to create a definitive and comprehensive list of aerosol generating procedures for dental settings. However, commonly used dental equipment known to create aerosols and airborne contamination do include ultrasonic scalers, high-speed dental handpieces, simultaneous use of the air-water syringe, air polishing, and air abrasion. Now, one of the considerations in the OSAP guide is that during the COVID-19 pandemic, aerosol generating procedures are not really necessary to provide preventive dental services to students in school sealant programs. Students that with restorative or other dental needs that require the use of aerosol generating procedures should really be referred to a fixed dental setting for that treatment. Other considerations are really to avoid the use of dental handpieces, air polishing, air abrasion, and ultrasonic scaling, and any other type of aerosol generating procedure. So you may want to consider the following: performing toothbrush prophies, using silver diamine fluoride to help arrest decay, and placing fluoride varnish to help strengthen the enamel and prevent dental decay. When selecting sealant material, one of the things you may want to do is consider using glass ionomer sealant material instead of resin-based sealant materials. Placing glass ionomer sealants actually does not require a dry field and will be less likely to create aerosols during placement. Placement of resin-based sealants requires a dry field, so if this type of material is used, consider engineering controls designed to control aerosols in dentistry to reduce spatter and potential aerosols. Examples of these controls would include intraoral isolation system, intraoral use of high volume evacuation, four-handed dentistry, and properly placed air filters with HEPA filtration. Now, prior to going into a school, there are also some considerations in your planning. Consult with state, local, territorial, or tribal departments for the current information about requirements specific to their jurisdictions and to determine how the degree of COVID-19 community transmission will affect local policies. Develop a written infection prevention and control policies and procedures plan specific to COVID-19, and make sure that all dental healthcare personnel involved are familiar with the plan. Consider using the OSAP DentaQuest partnership best practices for infection prevention and control in dental clinics during COVID-19 pandemic as a tool to facilitate the infection control plan development. The IPC plan should be made available to school administrators and parents, both when requested and even not requested. This can be accomplished by providing a link to a website with the plan, such as your organizational website or on a school's website, or via paper note connected to the parent permission slip. Use as many communication methods as possible to clearly communicate enhanced infection prevention and control procedures. Revise the policies and procedures plan when guidance from CDC or state and local authorities is updated. And include a plan for transportation of dental healthcare personnel so that team members may travel separately in case one member falls ill while at work. Communicate with the appropriate contact at each school to ensure the school sealant plan is following site-specific policies set by the school administrators. Identify the specific contact person for the school to communicate with if a student presents with symptoms of COVID-19 or other respiratory illnesses, including fever. There's more information on screening and exposure to SARS-CoV-2. See the CDC Interim Infection Prevention and Control Guidance for dental settings during the coronavirus disease pandemic, and the CDC Interim Guidance and CDC's case investigation and contact tracing in K-12 schools, and we have direct links to those documents in the guide. Now, each day before entering a facility, dental healthcare personnel and other team members should monitor for fever and symptoms consistent with COVID-19 or exposures to others with COVID-19 symptoms or have confirmed infection. Now, fever is either measured temperature that's equal to or greater than 100 degrees Fahrenheit or subjective fever. If any person from the dental team has a temperature of greater than or equal to 100 degrees Fahrenheit, they should not enter the school building. Providers should complete a self-attestation form regarding symptoms and keep a daily log when going into the schools. Now, CDC does have a sample facilities COVID-19 screening form that can be a useful tool. If dental healthcare personnel experience any symptoms, they should not report to work or, as we said earlier, enter the school. Now, there's more information in documents, including CDC's criteria for return to work for healthcare personnel with SARS-CoV-2 infection, which is an interim guidance, and also information on work restrictions for healthcare personnel with underlying health conditions. And this can be found in CDC's healthcare workers' clinical questions about COVID-19. You should be considering reviewing the immunization records for all personnel, including COVID-19 vaccine. You want to make sure that these immunizations are up to date and consistent with current Centers for Disease Control advisory committees on immunization practices, recommended vaccines for healthcare workers. Consider visiting each school prior to setup. This will allow dental healthcare personnel to explore the assigned space and determine all the equipment and products needed for safe setup. Other considerations in selecting space in a school would include avoiding areas using cloth upholstered furnitures, as well as carpeted treatment areas. Try to request a location for services in an area that has hard flooring. If a space must be used with carpeting, cover the carpet using things such as large sheets of plastic, transportable interlocking tiles, and setting it up prior to bringing the equipment in. If using plastic sheeting, ensure the edges are secure with a gentle adhesive such as painter's tape, because you want to prevent tripping. If interlocking tiles are used, ensure that you're cleaning and disinfecting them as part of daily housekeeping services. Now, if you do and are able to access an area with hard flooring, communicate with the site administrators about the schedule of cleaning the flooring in that area. The floors should be cleaned upon removal of the dental equipment. If the site janitorial service is unable to clean immediately upon exit, then the dental team should appropriately clean and disinfect the floor before they leave the facility. or use a floor covering. You want to make sure that others are not congregating or sitting on a potentially contaminated surface. Other considerations are that it's important to always follow device and product-specific manufacturer's instructions for use for both maintenance of all dental equipment and its use. Update logs prior to using dental equipment that has been out of service. Some examples include shocking and testing water lines, cleaning and maintaining sterilizers and biologically monitoring sterilizers before putting them back into use, and updating your maintenance logs. You can create Excel spreadsheets to identify the equipment, location of the manufacturer's instructions for use, and documentation of the actual maintenance. Now, I'm going to turn it over to Jill, who's going to go into the next section of setting up the dental treatment area in the school. Jill, it's to you.
All right. Okay. Thank you, Kathy. So yes, we're now going to look at setting up the dental treatment area in the schools. So if there are multiple patient chairs used, provide at least 6 feet of space between each chair. Create easy to clean physical barriers of at least 6 feet between each patient chair. And if floor to ceiling barriers are used, check to make sure that extending barriers to the ceiling will not interfere with fire sprinkler systems. There are a variety of materials that can be used for barriers, including plexiglass on a floor stand or lockable wheels or framed plastic walls. And consider using portable HEPA air filtration systems to enhance ventilation. Select a HEPA air filtration unit based on the CADR, which stands for Clean Air Delivery Rate. This Clean Air Delivery Rate is an established performance standard defined by the Association of Home Appliance Manufacturers and reports the system's cubic feet per minute rating under as-used conditions. The higher the clean air delivery rate, the faster the air cleaner will work to remove aerosols from the air. And if possible, patient chairs should be oriented parallel to the direction of airflow. So where feasible, consider patient placement carefully and placing the patient's head near the return air vents, away from pedestrian corridors and toward the rear wall. And more details about the HEPA air filtration is going to be discussed in the following slide. To prevent real or perceived contamination to a larger area, some school sealant programs may operate by creating a semi-enclosed dental space by using materials such as shower curtains, plastic sheeting, or 3-wall pop-up tents, either with or without a top canopy. Any reusable materials that are used should be able to withstand exposure to disinfected products. So with cloth curtains, they should be removed and bagged for transport and laundered daily. Another alternative for disposable plastic or vinyl curtains that are disposed of daily, if curtains are visibly contaminated by blood or other potentially infectious materials, they should be promptly and carefully removed, folded onto themselves to contain contamination, moved to an appropriate cleaning location, and then the surface should be cleaned or disinfected using an EPA-registered hospital disinfectant. If programs attempt to create an enclosed dental workspace, care should be taken to ensure that the safety of the dental treatment area is not compromised, and that enclosure of the space does not lead to stagnant airflow in the room or in the treatment area. Programs should consult with facilities operations staff or a heating, ventilation, and air conditioning specialist to make this determination. Each dental workspace must have ventilation within the space. This may require the use of enhanced ventilation, such as a HEPA air filter. When in use, the patient's head should be oriented at the rear of the space, opposite of the entrance. The air filter should be placed behind the patient's head, across from the dental health care personnel. Ensure that dental health care personnel is not positioned between the unit and the patient's mouth. Position the unit to ensure that it does not pull or push potentially contaminated air into or past the breathing zone of the dental health care personnel. Some HEPA systems may allow exhausting the HEPA cleaned air out of the rear of the space, which would provide a protective directional airflow. In addition, the program must ensure there is sufficient clearance at the top of the enclosed space so that it does not interfere with fire suppression systems, which is generally about 18 inches, but this should be verified with a local fire marshal. Next slide. All right, so if you're using a mobile van or bus that allows for students to exit the school building to enter the mobile unit to receive dental treatment, follow the CDC Interim Infection Prevention and Control Guidance for dental settings during the coronavirus disease 2019 pandemic, and limit the number of patients in the van to ensure social distancing. If treating more than one patient at a time, ensure social distancing of at least 6 feet and use barrier walls between the dental chairs. If in-classroom education is prohibited, consider some creative ways to provide oral health education to students. For example, you can consider individualized chairside education during delivery of preventative oral health services, and or creating an oral health education modules and post them on the school Sealant program website. Provide an information sheet with links to the web-based information and resources to the students at the time of oral health services. Parents and guardians can also be emailed this information that you create. We're now going to discuss transporting students to the treatment area. If possible, bring only one student per provider into the treatment area at a time. This will reduce the risk of exposure to students and staff. When students are escorted from the classroom for treatment, the coordinator should wear a surgical mask and maintain social distancing, which is 6 feet, from the student. A gown should not be worn when escorting patients or when outside the direct treatment area. Providers should be screening students for symptoms, including fever, either before transport or upon arrival to the treatment area. Document the screening and responses in the patient chart. The symptoms can be found at the CDC Symptoms of Coronavirus website, where they're updated regularly. There may also be additional screening items required by any state or local health authorities. So you'll want to take the temperature of all students. And if the temperature is 100 degrees Fahrenheit or greater, then dental treatment should be deferred. A contactless thermometer will aid in maintaining distance while you take the temperature. Refer to site-specific school policies and procedures to determine the next steps. If the student reports symptoms, defer treatment and report to the designated contact person at the school. And for more information on screening and exposure to SARS-CoV-2, see the CDC Interim Infection Prevention and Control Guidance for dental settings during the coronavirus disease 2019 pandemic, and the CDC Interim Guidance for case investigation and contact tracing in K-12 schools. And next, we're going to discuss during patient care. So concerning hand hygiene, all students should either wash their hands with soap and water for 20 seconds prior to and immediately following their dental visit, or use alcohol-based hand rub containing at least 60% alcohol and purchase from a medical or dental supply company. Providers should follow current CDC guidance on hand hygiene before, during, and after each student appointment. For source control and respiratory hygiene and cough etiquette, all students are encouraged to wear a mask or face covering during transport to the treatment area. Defer treatment for any student with a persistent cough. When a mask is not worn, encourage students to cover their mouths and noses when, if they're coughing or sneezing. For example, you can teach students to cover their mouths and nose with a tissue when they sneeze or cough. If they don't have a tissue, they can use their elbow, and they should wash their hands often, especially after coughing or sneezing. It's a good idea to provide tissues and no-touch receptacles for the disposal of the tissues. Concerning PPE for personal protective equipment, school Sealant programs should only provide services if they have the necessary supply of PPE to treat patients safely in accordance with the CDC Interim Infection Prevention and Control Guidance for dental settings during the coronavirus disease 2019 pandemic, and CDC optimizing personal protective equipment supplies. You should know the daily burn rate for the PPE that you're going to be using in each school building to make sure that you have enough supplies on hand to treat patients daily. If enough PPE is unable to be secured, delay treatment until necessary PPE is readily available. And the CDC burn rate calculator is a useful tool that you can use to help determine your burn rate. And you should adhere to current CDC guidance for PPE and non-aerosol generating procedures. And the CDC has resources on their website for using PPE, including the sequencing of donning, there's putting on, and doffing, the removing of PPE. So please consider utilizing these resources. They can be printed and posted around your workspace. Next slide. Adhere to current CDC guidance for PPE for non-aerosol generating procedures. In schools located in areas with low to minimal community transmission, healthcare professionals should wear a surgical mask, universal eye protection, a gown or protective clothing, and gloves during procedures for all patient encounters. In schools located in areas with moderate to substantial community transmission, dental healthcare personnel working in facilities located in areas with moderate to substantial community transmission are more likely to encounter asymptomatic or pre-symptomatic patients with SARS-CoV-2 infection. If SARS-CoV-2 infection is not suspected in a patient presenting for care based on symptom and exposure history, the dental healthcare personnel should follow the standard precautions and transmission-based precautions if required based on the suspected diagnosis. The dental healthcare personnel should implement the use of universal eye protection in addition to their surgical mask to ensure the eyes and nose and mouth are all protected from exposure to respiratory secretions during patient care encounters, including those where splashes and sprays are not anticipated. Wear masks and eye protection for all patient encounters. So respirators are recommended during aerosol generating procedures. Because the aerosol generating procedures are not necessary in school sealant programs, the use of respirators is not indicated. However, if a provider chooses to wear a respirator, respirators should be used in context of a comprehensive respiratory protection program, which includes medical evaluations, fit testing, and training in accordance with the OSHA respiratory protection standard. The respirators with exhalation valves are not recommended for source control and should not be used during surgical procedures because the unfiltered exhaled breath may compromise the sterile field. So if only a respirator with an exhalation valve is available and source control is needed, the use of an electrocardiogram pad or surgical tape secured over the valve from the inside of the filtering facepiece respirator can provide source control similar to that of a filtering facepiece respirator with no exhalation valve. Clinicians should be controlling the saliva ejector at this time, and students should not close their mouths around it. Consider using the safe saliva ejector technologies that have valves to prevent backflow. And to reduce splatter, consider using an intraoral isolation system for all students who can tolerate it. So concerning paperwork, to reduce potential contamination, consider keeping paperwork outside of the immediate treatment area. Considerations include using a laminated dental chart that's used chairside to make notes on that can be then used post-appointment to transfer the details to the official paperwork. And then the laminated sheet can be wiped down for the next use. Another alternative is to use digital devices for record keeping. And if digital devices are used, place disposable plastic barriers on the device and change the barriers between each patient. All right, so now we're going to discuss managing patient care items. To help manage patient care items, the dental healthcare personnel should follow CDC guidelines for infection control in dental healthcare settings from 2003 for reprocessing of reusable patient care items. Reprocessing reusable critical and semi-critical patient care items in a school or non-healthcare care setting, it will pose some challenges in ensuring proper processes are followed. School sealant programs can prioritize the use of single-use disposable items and materials, such as disposable mirrors and disposable explorers, unit doses of sealant material, fluoride varnish materials, and the such. By using single-use disposable items, the school sealant program can avoid the need to pre-process these instruments. And if the school sealant programs do need to reprocess instruments, programs can make arrangements with community health centers or community dental practices to reprocess their reusable critical and semi-critical patient care items safely. And in the guide, there are also a variety of additional considerations. We're now going to discuss the environmental infection prevention and control. So dental healthcare personnel should ensure that environmental infection prevention and control policies and procedures are consistent with the CDC guidelines for infection prevention and control in dental healthcare settings from the 2003 guide. Routine cleaning and disinfection procedures are appropriate for SARS-CoV-2 in healthcare settings, including those patient care areas in which AGPs are performed. So you'll want to refer to the list N on the EPA's website for disinfectants that have qualified under EPA's Emerging Viral Pathogens Program for use against SARS-CoV-2. Make sure that the disinfectant is on list N and is also hospital grade. Use surface barriers to protect the clinical contact surfaces, particularly those that are difficult to clean, such as the switches on dental chairs and any digital devices that are used, and then change the surface barriers between patients. Clean and disinfect clinical contact surfaces that can be adequately cleaned, and those that cannot be cleaned need to be barrier protected. You'll want to select the disinfectant by using the EPA registered hospital disinfectant with low to intermediate level activity for each patient. Use an intermediate level disinfectant, such as an EPA registered hospital disinfectant with the TB claim if it's visibly contaminated with blood. Clean housekeeping surfaces, such as floors and walls and sinks, with a detergent and water or an EPA registered hospital disinfectant or detergent on a routine basis. Depending on the nature of the surface and type and degree of contamination, and as appropriate based on the location of the facility when it's visibly soiled. The efficacy of alternative disinfectant methods, such as ultrasonic waves or high intense UV radiation or LED blue lights against the SARS-CoV-2 virus, is not known. So the EPA does not routinely review the safety or efficacy of pesticidal devices such as UV lights, LED lights, or ultrasonic devices. Therefore, the EPA cannot confirm whether or under what circumstances these products might be effective against the spread of COVID-19. So manage medical waste according to federal, state, and local regulated waste regulations. Consult with the school sealant program site to determine if non-regulated waste will be disposed by the site, or if the school sealant program must take all their waste, regulated and non-regulated, away with them from the site. And sharp containers should be placed in a secondary container, such as a waste can or a box, for transport to prevent possible spillage during transport. And now we'll discuss briefly some program monitoring and evaluation resources. Dental healthcare personnel should monitor and evaluate the infection prevention and control program to assess compliance with the current CDC guidance and program-specific policies and procedures. The ITC program should be updated when there are changes in the CDC and any state and local specific guidance. Methods for program monitoring and evaluations should be established. There are resources from CDC and OSAP that may be helpful, but some of these resources do not contain some of the current guidance from CDC interim infection prevention and control guidance for dental settings during the coronavirus 2019 pandemic. So CDC and OSAP resources include the CDC Dental Check app and OSAP site assessment and OSAP infection control checklist for dental programs using mobile vans and portable equipment. And these links will be found in the guide. And now I'm going to hand it back over to you, Kathy, to cover some additional references and resources.
Thank you, Jill. Now, in terms of references and resources, we have 3 slides of these references and resources, but they're also embedded in the guide with the specific content areas in each section. They're also listed at the end of the guide with hyperlinks directly to the documents. And we have 3 of these, so I won't review each one of them now. Another thing that I would like to cover is a little bit about OSAP. We have a number of tools and resources on the OSAP website, including Ask OSAP, which is made up of questions, and you can send questions into OSAP, and your answers will be posted. Now, sometimes when you ask OSAP, we may already have a frequently asked question that you can just be referred to. There's also infection prevention and control toolkits available. Infection Control in Practice, which is a publication that comes out, which is very, very useful, and it's sent electronically to members. And then we have what's called Info Bites, which go out each Monday. And these Info Bites address current late-breaking information, updated resources, and other information relevant to infection prevention and control in dentistry. Now, what can OSAP do for you? Well, we talked about the resources through CDC Dental Check. We talked about the resources that are available for portable and mobile programs, including the checklist from OSAP. But this tool is one that is very useful right now as well. And it's best practices for infection control in dental clinics during the COVID-19 pandemic. DentaQuest Partnership funded OSAP to develop this document, which includes an extensive checklist that covers all of the current interim guidance from CDC, OSHA, the American Dental Association, the American Dental Hygiene Association, and anytime that guidance is updated, the checklist is updated. So visit it frequently, it's free and downloadable, and I think you can find it very useful, even in your school sealant programs. Another document, which is also downloadable from the OSAP website, was a project that DentaQuest Partnership funded OSAP to do to develop this one-page 4th grade reading level document for patients. It really, in very plain language, describes the infection prevention and control in dental settings during COVID-19 to help patients understand about receiving safe dental care. Another valuable resource, and I think this is so important for any dental setting, including school sealant programs, especially for school sealant program coordinators and lead individuals in the programs themselves. And this is the OSAP Dale Foundation Dental Infection Prevention and Control Certificate Program. It's 3 components. The first one is actually a continuing dental education module. It's electronic. It's reading the CDC summary of infection prevention practices in dental settings and answering some questions, and you get 2 ADA CERP credits for completing it successfully. The next is the OSAP Dale Foundation Dental Infection Prevention and Control e-handbook. This is 10 CE credits, and I sort of refer to it as a mini course in dental infection prevention and control. You'll go through the entire e-handbook. You'll be challenged with questions. Doesn't matter if you answer them right or wrong, it gives you feedback, but you do need to complete the entire e-handbook. And upon that completion, you then become eligible to take the OSAP Dale Foundation e-handbook assessment. And that is basically an online test. Once you successfully complete that, then you can get the Infection Prevention and Control Certificate. Again, this is a knowledge-based certificate, and I encourage all of you to take a look at this. You can access it off of the OSAP website. You can also go to dentalinfectioncontrol.org for more information on this and some upcoming certification programs. Okay, I think we'll move to questions at this point in time. And see what we have.
We do have some good questions here, Kathy.
Okay, I haven't opened the chat yet, so I'll let you lead the way, Jill.
Okay. There's one here asking if the school is only allowing children into the school after checking their temperature, do you still recommend that we check their temperature prior to treatment? And I would say yes. You're going to be assured for yourself that you know what that child's temperature is at the point that you're seeing them. And then also to be able to document it in your records to have the evidence if you need from what the temperature was when you saw that student. And there's also a point, you know, the kids can get sick mid-school day. So they might enter the school without a temperature, but then they might fall ill mid-school day and before you see them. So I would say it would just be a good idea to consistently just get in the habit of taking temperatures and documenting it.
You know, the other consideration, and Jill living in Michigan and I live in Massachusetts, in the wintertime, if kids are getting out of cars or getting off of a bus and walking into the school in really cold weather, that temperature that's actually taken upon entrance to the school may not be an accurate temperature. So that would be another consideration. Absolutely. Yep. Good point. What's going on outside? And vice versa, if they're in really warm temperatures, right? It might be a good idea to get more of an accurate reading, because I know in the summer we had some temperatures where people could not get dental treatment when really they were just kind of overheated from waiting outside because they weren't allowed in. Okay. I have one here, Jill. It says, any thoughts on preferences for mobile vans versus portable operations to mitigate risk of transmission? And what are the pros and cons of either setting? Well, I guess if you would already have a mobile van, that would be one answer. Keeping in mind, though, the mobile van should be treated just like a fixed dental clinic, in essence, for the infection prevention and control guidance compliance. Also, the size of the van, the number of children that can be accommodated on the van with social distancing and separation. Portable operations, if you can't get into a school, sometimes, and this is one of the things that our Forsyth Kids program has done, we've actually outreached to children through some Boys and Girls Clubs. And that's been worked well because the schools are either are closed to operations coming into the schools, or you find that the schools aren't even open yet. Some of the schools are still remote. So you may find other places where you can set up and be able to provide care. Any thoughts, Jill? Yeah, I would echo that. I mean, like the question says here, pros and cons for each setting. You know, one of the benefits, if you do have a mobile van that you can use, is you're going to know the inside your working space. You'll always know it before you get there. So if you're going into a classroom at, you know, school A and a different room in school B, you're going to need to go and assess it early and really look at the setup. Stand back and take a minute and look, where are the windows, where are the vents? Is there a vent in the ceiling? Is it on the floor? Are they vents that are sucking air out? Are they vents that are blowing air in? And then you're going to need to set up your unit with that in consideration, because you're going to want to really consider the way that the air is flowing in each room. And if you do have a mobile bus, you're going to already know that. You know your setting, and you're going to already have all of that squared away as to where your HEPA filter should be placed, and all of that set up before you start your workday. Here's a question, Jill. It says, is pumice spatter created when cleaning teeth to be sealed, either with a motorized or hand brush? Is that considered an aerosol, or are the particles too big?
Did you want me to take that, or do you?
Well, I guess one of the things to consider, if let's say you would be using a slow speed handpiece. The issue becomes the slow speed handpiece with the pumice. Now you mix it with saliva and you get more spatter. In terms of aerosols, it's difficult to really know because how much fluid or water is there and how much control do you have over that. That's why anything that's rotary and moving poses a greater risk of potential aerosol generation. And most of what we know that we do is generate spatter, but whenever there's a potential for an aerosol, you want to try to do something in lieu of that can be done, such as toothbrush prophies, hand brush. Jill, would you like to add some things to that?
Yeah, I think you answered it well there. For terms of a school sealant program, I think just deferring to the toothbrush prophy is probably appropriate. And just right now during this time, we do need to be extra cautious on anything whirling or whizzing or spinning in our areas around saliva. So I would definitely echo Kathy there and just kind of try to avoid that at this time.
Here's a question. Do you have a recommendation for an air purifier with HEPA filtration? I don't recommend products. I think what you have to do is look at the space in which you're going to be working and sort of the square footage if you create an enclosed space, and then figure out what the clean air delivery rate would be best in a HEPA air purifier that you would use. And there are a lot out there. You might actually consult with an HVAC specialist to get a recommendation and guidance. Because what you're doing with that HEPA filtration is that it's circulating the air. It's going to increase the air exchanges per hour, but also filter that air. There are also some air purifiers that not only have HEPA filtration, they also have internal UV light. So there's a wide variety that are in the marketplace. I'm sorry, Jill, go ahead.
No, I'm sorry. I didn't mean to interrupt. So yeah, I was just going to add that, really just doing your homework and looking at, meeting with somebody who knows a lot about the different types, because the different sizes also will be a consideration. So, I mean, there are some pretty huge filters that would not, they might recirculate the air at a great speed, but they're not going to be appropriate to be traveling around, moving from place to place. Or if you're in a bus, you might be able to go with a little bit larger of a unit because you're not going to be physically moving it in and out of classrooms. So I think your recommendation there to really talk to a specialist is probably a great way to go.
Here was a question. It says, do you know how many school sealant programs have returned to the schools? I don't know. I don't think there's any sort of central reporting for that at this point in time. Probably region by region, area by area. I do know that some programs have, because they have reached out and asked some questions, but I can't give you any definitive number.
Yeah. There's a question here, then we'll hand it back over to Ashley after we answer this question on paperwork. So the person is asking about paperwork. What's your suggestion on charting and paperwork at the school-based clinic? And during this time, if you can keep paperwork away from the direct clinical area, that would be helpful so that you're not potentially transporting any virus back with you, or getting it in folders or locked containers, or however you transport your work. So one suggestion that was covered in the presentation was you can laminate your paperwork, and then you can take that chair side and write everything down, do all of your charting and notes on it. And then once you dismiss your patient and you've cleaned your area up, you can go to a safe space and transfer that information then to the real official paperwork. Just copy it over and then wipe your laminated form down and move on to your next patient. So, and it's about 5 minutes here, and I know Ashley has some additional details. So if you're comfortable, we can hand it over to Ashley.
Sure
Thank
thing.
you, Jill.
Okay.
So in order to receive your CE verification of letter, you're going to need to complete a brief online evaluation. When the webinar ends, there will be a link that should pop up that you can click on, but we have also added the link to the chat. So feel free to click on that and start the online evaluation. If you have any troubles, any problems, please reach out to OSAP. Our email address is office@osap.org. And you can also give us a call. And I saw some questions about, access to the presentation, to the recordings. The recording will be added to the OSAP website. So we will email anybody who has participated or registered in general for the webinar a link to access that recording. And we have other resources that will be coming within the next week or two as well. So we'll make sure to share that with you. And I just wanted to say thank you to our fantastic speakers and for everyone for attending today's webinar. Again, if you have any questions, please feel free to reach out to OSAP at office@osap.org. And with that, have a great weekend.
Yes, thank you all very much. And I hope you do find the guide useful, and we appreciate your feedback. Thank you.
Thank you.